So I just did a video on how to recognize pancreatic cancer and what is pancreatic cancer. I finally just had to trash that video. I went into Medscape and it was so burdened with ads that we couldn't actually see what I was trying to show you. I'm going to try it this time on not Medscape, but WebMD. So we'll see what we see here. First of all, one of the most famous patients that died from pancreatic cancer, Steve Jobs, Apple co-founder, died in October 5th, 2011. He was diagnosed in 2003. Jobs had an islet cell tumor, neuroendocrine, meaning that the beta cells had formed a cancer, and so it would make insulin. It's a rare form of that disease. U.S. Supreme Court Justice Ruth Bader Gunsburg, the Notorious RBG, actor Patrick Swayze. They've also both of them have faced pancreatic cancer. Swayze died in 2009, and the lifetime risk for pancreatic cancer is about 1 in 65. What is the pancreas? It's situated behind the stomach. It's a 6-inch long spongy organ, and it makes the enzymes like amylase and lipase, which help your stomach and your intestines break down fats and proteins so you can absorb them. The islets of Langerhans, or the beta cells, also make insulin. How does it present? One of the classic presentations is jaundice. You see the yellow eyes there. And that happens because sometimes the cancer will block the release of bile. Bile from the liver is released in the same bile duct, a common bile duct, or what's called ampulla levator. No need to remember any of that. But it can result in blocking the bile from the liver and therefore causing jaundice. We're having an event November 8th and 9th in Louisville. Check it out. To find it, you just go to our homepage and click here for more information. Sometimes it presents as belly pain. Sometimes it presents as back pain. Usually it's not treatable. Over 90% of them are not treatable by the time they're discovered. Are there any lifestyle things that are linked with it? Yes. Guess what? Smoking. So your lifetime risk is doubled if you've been a smoker. Family history of pancreatic cancer, high-fat diet, obesity, and lack of exercise also may play a part. How do you diagnose it? Well, the viewer that asked about this had happened to have an abdominal CT. They saw a cyst in a couple of places in the pancreas area. So they confirmed again with an MRI. All they could confirm was that there was a couple of cysts, or small bubbles sometimes filled with fluid, usually. So they couldn't tell whether that's cancer or not. So then the next question becomes do we want to do a SPECT scan, which can sometimes help? Do you want to do a needle biopsy, in which a radiologist goes in, guided by X-ray technology, to find it and get a piece of the tissue? Or do you want to wait? The advice for this viewer was to wait. And that's a difficult year, waiting to find out if you have pancreatic cancer. It's similar to what happens quite often with coronary artery calcium scores. You know, that's yet another reason why that test the calcium score is not one of my favorites. We will often have this happen. My wife was one of these patients. They were doing the CT scan in that area, and they found a couple of nodules in the lung. Now what do? You go in, do you scope them to get a piece of that nodule? Do you do other studies? There's really not more that you can do. Do you do surgery, or do you sit and wait, and with the patient wondering, are those nodules in my chest cancer? It's the same challenge this viewer has. Again, very, very difficult emotionally to deal with it. What's the treatment? Surgery. You can try radio. You know, it's as with typical cancers, typical bad cancers. Surgery is the biggest one, basically just trying to debulk the tumor. Radiation, again, also trying to decrease that tumor, but again, cures are just not that common with pancreatic cancer. Chemotherapy, there's like like a lot of cancers, they're starting to develop more targeted therapy where the body's looking for abnormal pancreatic cancer cells. And immunotherapy is growing out there. So there's hope, but right now it's mostly just what we call palliative treatment, which means making your life a little bit easier while you're still here. Getting support, and is prevention possible? Well, if you smoke, quit. If your diet's high in fat, Now, how big a risk is this for those of us who are starting to add fat in our diet? I'll tell you this. It's sort of like that thing on, oh, do you have a lot of risk getting a second coronary calcium score? Maybe add 1% or 1 in 1,000 on one side versus 10, 20, 40% death over the next 10 years from heart attack. I'm not too worried about high-fat diets causing pancreatic cancer. But you do want to, as with everything, you want to adopt a regular exercise routine, work and do what you can to prevent diabetes, obesity. Make sure that you're watching your BMI. So thank you very much for your interest, and I'll get a little bit more technical in the next video on pancreatic cancer. Thank you. Hey, if you're interested in a 2-day boot camp type of environment where you get your CIMT, you get all your labs, and we spend 2 days going over the whole thing, check out our event. It's November 8th and 9th at Louisville. Great place to fly into at the University of Louisville.